Good afternoon, everyone. I'm Adrian Sharkundi. I am Corporate Responsibility Director for Volker Vessels UK, and we were one of the sponsors for the SECBE Constructing Excellence Awards this year in the Health, Safety and Wellbeing category. Welcoming everyone this afternoon to this session. We're going to be talking about learning from the coronavirus pandemic. And we're going to be having a session where we have a poll question for everyone to answer, and then the panellists, who I'll introduce in a second, I'm going to direct some questions to them, and then within the chat, within the questions and answers section of Zoom, you can actually direct any Q and A questions that you have to us. And we'll go through those at the end. We are fixed on time, so it is a strict 45 minutes. So the SECBE in the background will be keeping us to time, but hopefully we'll have some opportunity at the end to go through those questions with the panel. So let me just go forward and introduce the panellists, if I may. So this was, I say, as part of the category for health, safety and wellbeing. So we've got Ian McDonald from Midas Construction, Dr. David Greenberg from Eave. It's always good to have a doctor on a pandemic discussion. I'm going to resist the temptation for him to step in with lots of charts and statistics on the pandemic. We have Jason Wickenden from SWAG, Alex Wood from Overbury, and Ben Green from Martin. And I'll introduce those as we go through the questions during the course of the next 45 minutes. So the piece here that we're discussing, and we're looking to gain some insight and inspire some thought around the subject, and obviously the pandemic and coronavirus has been at the forefront of everyone's minds over the past year, 18 months, and it's something that we've all collectively experienced, and we all have a common understanding of some of the challenges. The construction industry itself has demonstrated that it can be one of the most innovative industries, and the discussion today will centre around whether the industry will adopt some of the learnings that we picked up and experienced during the pandemic. And that includes revised ways of working. There are some obvious realities to construction in that the structures that need to be built and maintained can't be done with if everyone worked at home. And whilst that reality is there, is just one of the subjects that we're going to touch on this afternoon, as I say, from the poll and from some discussions with the panellists. So what we'll do is we'll start with the poll. So it's a simple question. So if you could just bring that up for me. So you should see the poll appear on the screen. And we're looking for one statement that best reflects your expectations of where the industry goes from here. As we're on the cusp of I think they're calling it Freedom Day now, and the end of the last lockdown. I hope it's the last. And if you could just provide your answer on which statement best reflects your expectations. Some of it is focused around, hybrid or flexible working, but some of the options there are around, use of technology. So there isn't a right and a wrong answer to this poll. Just very interested in terms of what people's expectations, and perhaps also a reflection of what your experience have been to date, particularly this year. So if you could kindly submit your response. And then we'll bring up the response, if we may. Okay, that's interesting. Hopefully everyone can see that on the screen. And it's interesting, I guess, reassuring that no one's actually responded by saying that the industry will return to the way we always were. And there's obviously the largest result there is around hybrid. So hybrid being the mix of home and workplace working arrangements, certainly the highest in the score. Some continue to use aspects of Teams or Zoom, and then some widespread adoption of hybrid working. And it's some of those areas that I'm keen to discuss with our panellists. And as I say, feel free to drop any questions that you have on the Q&A section at the bottom of the screen. So I'm going to turn to my esteemed panel that we have here today and thank them for their time. And it's a good opportunity with this session, not just from their submission with the awards, but also ask them some further, more detailed questions around this particular subject, which some cases did feature in some of their award submissions. So let's start with a question to Alex. So Alex, I'd like to ask a question about how did you engage with your employees about learning from the pandemic, or how are you going to engage?
Well, I think it's been pretty hard work. We carried on from sort of day one. So there was a lot of learning. There was a huge amount of innovation from the site teams, thinking up new ways of social distancing, what they could do to make life easier. I think sort of longer term aspects that we've are far more embedded are general housekeeping, making sure that there are specific areas for storage from the various contractors, and general cleaning of the site. You know, the sites are a lot cleaner, which makes guys' lives much nicer, and those will continue, I'm sure.
And did you feel that the response and the engagement that you got as part of that process and bringing in some of those changes, was it well received?
Yeah, very well received. You know, we had some hurdles. We had some outbreaks on a few sites, which creates confusion for everyone. But no, gratefully received, and you know, people are pleased to be at work really, and have been throughout.
I think that's one of the interesting things, actually, so from my experience, is seeing people, you know, that were previously working from home for a long period of time, returning to the workplace, and actually, you know, enjoying that interaction as social creatures and being around people. It's actually making quite a lot of difference to people's well-being, just having that simple human contact.
Very much so.
Yeah. And most people wouldn't have thought we'd be saying that either. Thank you, Alex. My next question is for Ian. So I'm interested in whether your organisation has a strategy relating to something like hybrid working or agile working or remote working. There's a whole raft of terms in play at the moment that you constantly have to check. So is there something you have in place or you're considering? Ian, I think you're on mute.
There we go. Yeah, so I've got a senior leadership team that meets monthly, who are actually trying to establish now the hybrid working scheme. I mean, what we have recognised that it does work. You know, the system is more difficult for guys working site-based, but certainly, you know, office-based and support staff works exceptionally well. So yeah, they're working through that strategy right now.
And I'm just going to bring Jason in at that point, if I may, actually, in terms of linking into that. One of the been doing a fair bit of reading around the subject over recent weeks as the advice is changing, but guidance suggests that the key to flexible working is an open approach to employees about first assessing which roles are suitable for flexible working, and that's a particular challenge for construction because you'll have a mix of site-based staff and operational staff. So my question is, in terms of that challenge for organisations of having site-based staff and office staff, do you think that those that are site-based will be frustrated by any communications around others having the opportunity to work from home?
Yeah, we anticipated that with the first few lockdowns. Obviously, the office was closed with director going in once a day just to make sure things were okay. But we realised that people on site needed to know that the support was there from the directors and other staff members in the office who could work remotely, especially as we found that a lot of our site staff were ostracised in the early days when the government weren't providing direction, and that we were considered to be a key essential worker that needed to be on site. And we had people being vilified by use of unnecessary language and actions to our site staff when they should have been working. But yeah, we do make sure that we're there to support the site staff. We make sure that we are there in person when they need us, and we do ensure that we go out on site to offer that support. So we try and avoid that frustration. We can see it coming, and we've tried to hit it off at the pass.
In terms of that in particular, and there's different types of anxiety. So, there's obviously the industry's been able to work throughout the pandemic, and there's been, particularly during the early months, there are a significant number of challenges, and we certainly saw it as an organisation that in some cases we were having some of our operatives that were working on the street being challenged by members of the public as to why they were actually at work, and being open and honest, some of that was getting, I won't say it's quite so vicious, but it was getting quite heated. And the other challenge around those that were continuing to work was also the anxiety that their families may have actually been experiencing from their partners going out to work. So have you had any conversations within your organisation about that particular aspect and being considerate of the family unit? Yeah,
we found some of the families didn't want their loved ones to come to work because of the associated risk of being on a construction site, which isn't the optimum of places to work at the best of times. But obviously with the regime of cleaning, but some people stayed on furlough longer than perhaps would have been preferred by us, just because of their domestic arrangements or the domestic situation. So we took a sympathetic view as best we could. Obviously, still got a business to run, but we did consider the wider family. We're a small SME, so family is key to us, and maintaining that throughout. And we're seeing that in payback now with the support we're getting from the staff through these difficult times of sort of shortage of materials and things like that. People trying to work with us. So we recognised it, we helped it, we supported it, and now we're getting the payback.
Good. Okay, I'm going to start bringing in some of the other panellists there, just itching to get into the conversation, hopefully. So Ben, in terms of some of these discussions we're already having, what do you see some of the challenges or barriers of flexible or hybrid working are in construction? There's been a number of news releases recently about organisations from the Federation of Piling Specialists to others like Kier trialling flexible working arrangements on site. But what do you see as some of the barriers around putting those procedures and policies in place?
I think construction is not unique. I think there's probably a lot of sectors that perhaps flexible working doesn't necessarily lend themselves as well to as perhaps other sort of industries and other sectors. So I think there's a clear divide between perhaps office working and site working. I think we've probably all experienced that over the last 12, 18 months. Ultimately, we're all under pressure to deliver to programme. So the idea of a sort of, you've got a new school, you've got to deliver, it's got to be open by a September 2022 date. You're probably not afforded the opportunity to have a longer programme where you can perhaps be more flexible, manage your sort of staff load, manage your sort of numbers of people on site to allow that. So I think the flexibility of working for people on site is very difficult. I think you've got to get the buy-in from people, and I think it's a big change in culture, particularly in the construction industry, to have a flexible working practice. That being said, I think people have responded very well, and I'm not saying it's anywhere near sort of business as usual, but can I see flexible working being a sort of a key to construction? Personally, I think it's going to be a challenge. I think as a business, we've certainly been as flexible as we can, and like many of you, we've had to sort of respond to the challenges that COVID bring, and the protocols, the procedures we've had to put in place, how we've had to support employees, sort of mental health, physical health. It's been huge challenges. So I think you can do everything you can to sort of create flexibility, but ultimately the pressures on site, as long as you've got you're following the guidance from sort of Public Health England and the Construction sort of Leadership Council, we kind of take their lead really, and everything was in place as much as we can do on site. But there's a lot of it down to the individuals as well, and making sure that you can give them the tools, you can give them the advice, you can put things in place, but you are very much reliant on your staff, on your people to adapt to that and be flexible themselves. But I think, the days of ultimately you've got to be on site to deliver the works. You can manage it differently on an office environment, but on site, you've just got to have the right working environment as much as you can. Okay,
thank you, Ben. I'm going to bring our resident doctor in, David. I'm going to use the opportunity to bring you in with a health-related question. This has come up a few times in the past year, and I'm particularly interested in, I'll start with your opinion, then I'll open this one up to the panel. In terms of, do you think that a focus on the pandemic has actually diverted our attention away from some of the common hazards of working construction that were always a challenge before, such as just general site safety, but also physical hazards? Have they been overpowered almost by the focus on the virus and also mental health?
That's a great question, Adrian. And the reality is, it's a simple yes. There's already data coming out from, I read an article recently from New Civil Engineer with Crossrail. They've got an increase in other safety-related incidents, and it's being sort of tied back to the almost disproportionate focus on measures required for COVID. And actually, if you just didn't know what to expect, so no one's to blame here. We didn't know how serious it was going to get. But what has happened is the usual things, the run-of-the-mill hazards, health exposures, hazardous exposures, safety issues haven't had as much time as they would normally get. Preparations, risk assessments, not getting the usual amount of time. And the data is proving it out that has resulted in an increase in exposures and other incidents.
I mean, obviously you work in a specific area. If anyone doesn't know your business, but in terms of the focus around hearing, are you seeing an increase, an uptake in direct contact, back to anything resembling whatever normal was, in recent months?
So our field service engineers are able to get out on site. So providing training, providing support, and installations and so on. So that is more or less back to normal, because that's just in line with sites being open and accepting outsiders, as it were, subcontractors. But besides that, you've really got a number of issues related to this. However, it has brought the spotlight onto health as and general holistic well-being, rather than simply safety. And the British Occupational Hygiene Society are often publicising this 90-10 split between sort of health and safety. And when you look at causes of death, 50, 60 people get killed from incidents, environmental awareness incidents, but you've got thousands dying every year from exposures. When it comes to noise exposure, we are seeing people realize that they don't need to be physically on site to measure that stuff. So remote monitoring, cloud-based monitoring, that's all going to become the norm. It's accelerated trends related to that. So bit of a silver lining. But no doubt people are not being encouraged to wear their protection in the way that they should. And the focus on eliminating traditional hazards at source, the focus has decreased as well as a result of COVID. And we are now plateauing, I would say, in terms of our understanding. We're sort of steadying the ship on sites. We understand now what to do when we go into lockdown, when there is a breakout and so on. I think we're still overemphasizing, retrospectively, it appears we've overemphasized some aspects of the controls, but we didn't know better at the time.
It's unprecedented times. Okay, I'm going to open that question up to the rest of the panel, really, in terms of whether you've seen any patterns in increased incidents and that you may have you believe may have been put down to the increased focus on the protective measures against the coronavirus. Has anyone seen any patterns in their businesses?
Can I take that one, Adrian?
Sure, thank you, Ian.
Okay. Yeah, so we've noticed that in certainly within Midas. And what we've done just recently is launched our Priority 6 stand down. So our Priority 6s are the usual working at heights, RAMs, public protection, underground services, slip strips and falls and asbestos. So what we're doing now, we're refocusing and trying to rebrand on that. Because what we're finding is people are getting fatigued with the COVID measures. And I think that's now drifted into, we're fatigued with that, so we're going to kind of be fatigued with everything else. And what we're finding is the actual response to the Priority 6 stand down is excellent. It really is. It's refocusing people. It's resetting the sites again. So it's working exceptionally well.
I think it's probably becoming increasingly hard to maintain requirements around social distancing, particularly when we see large sporting events. I believe there's been one or two, this week that have drawn some large crowds, and it's very difficult when you see those social environments where social distancing appears to have gone out the window, and then people are coming into the workplace, and we're still needing to enforce those social distancing requirements. It's very difficult face to face with that public environment. Anyone else on the panel like to answer that question?
Yeah, I think because the obviously the HSE were working remotely, and I think a lot of the small companies that don't have a stringent health and safety strategy in place were trying to cut corners, and I think the full statistic rate has gone up to 84% now, because I don't think they knew that they were going to be monitored by the HSE. So where they would normally put a scaffold up, a lot of these smaller companies were doing it off of ladders. So they've now had to go back to their usual ways, let's say. But the accident statistics show that there was quite a rise in falls from height during the pandemic.
Okay. Thank you. Ben, I think you were going to add.
Yes, thank you, Adrian. Yeah, I'm sort of surprised actually, sort of hearing it, not where it's sort of the contrast, but we sort of have our own, like many people do, have our own sort of dedicated health and safety manager, and we've kind of adopted a very firm, almost like zero tolerance to anyone sort of not complying, if you like, with our COVID safety procedures. We're fortunate insofar as a lot of our supply chain partners and the people on our sites are either directly employed or long-standing businesses that we've worked for a number of years, and we've actually probably found that our health and safety and the focus in general has actually improved across our sites with less accidents, less reportable instances. Whether that's some testament to our health and safety, our site managers that have been very, very hot on this. But I think in almost contrary to what's being said, it's actually refocused the attention a little bit for us with a number of sort of safety campaigns. And for us, our sort of focus has been more on the sort of the mental wellness, certainly in construction, and like a lot of industries, we've sort of had a few close colleagues, a few both directly within WW Martin and also some of our consultant partnerships that sadly have suffered from mental health issues. So we've been very, very tough in terms of enforcing COVID protocols, and I think in turn we're still making sure all our staff are attending their health and safety training, regular audits both internally and externally. And I'm quite surprised just to hear the sort of the contrast of sort of others' experiences, really, because from our point of view, it's been a good sort of refresher in the sense of the risks, not just what you can see, but what you can't. I think it's quite pertinent, really. We'll
drop your contact details into the chat, Ben.
Yeah.
We can take some direct queries. So there was some of you were talking about the mental health aspect as well, which has been ever present. And again, on a related subject, I guess, is the fact that there was, I went on an event last year, it was online, but it was a global event. It was discussing mental health during the pandemic, and across all the continents, there was this pattern of people not using some of the mental health services as much as they would, in the normal working day. And the thought around that was that people were so focused on the ever-present nature of coronavirus that they weren't accessing the traditional routes of mental health and physical support that have always been there. So there were, and that was also coming with feedback from the providers of those employee assistance programs. They'd seen nationally in the UK and globally a reduction in the use of their services during the pandemic. So my question to the panel is, how have you, engaged with your employees, particularly around anxiety, and also, reminded them of some of the routes to support that you may offer or are available nationally through national bodies? So who'd like to start me off on that one?
Can I jump in there?
Sorry, go on, Jason.
Yeah, obviously SWAG is paramount. It's trying to get everybody talking about mental health and reducing the stigma. We tried various different topics during the first lockdown. I was phoning all our employees that were working remotely, checking in with them and it soon became apparent that they were struggling with people in tears on the phone, not having that social contact. So we started SWAG, trying to promote mental health and wellbeing. We tried poster campaigns. We've set up dedicated private email addresses. We put suggestion boxes out that are confidential. But the only way we found to get people talking is to go and talk to them and say, hello, how are you? There's no better route than just putting a sort of warm, caring arm around people at social distance at the moment, obviously. But just talking to people. And our board had a meeting a few weeks ago. We decided that we would ask our health and safety advisor to go and do a toolbox talk on health and safety and mental health before going to do the check of the site, so that he was there and people were able to approach him in confidence about mental health. The first session, 16 operatives on site to sort out his help and now getting the help they need from the Lighthouse charity in particular, and obviously other support mechanisms. So just having a chat to people is still the best way of breaking down that barrier.
And whilst I've got you, I mean, we did a push before Christmas reminding people about the physical health aspects. And, I can tell you this because, it's all men on the call, but hopefully not on the wider audience. But, we're notoriously bad at going and getting, something sorted when something's bothering you, need to go to the GP. And we did some work before Christmas about encouraging people to make sure they're still accessing that service. Many were saying that, GP services and speaking to your GP remotely was actually easier than going into the GP surgery. So did you do anything about those kind of aspects, encouraging people that are still getting physical things checked as well?
Absolutely, yeah. We still maintained the physical attributes. We still ran occupational therapist visits to people that needed it and encouraged people, if they couldn't attend those, to use their GP services. But as you say, we're a macho, male-dominated industry, and we're never wrong, are we? We're always right.
Yeah, we'll try and. We've only got about 15 minutes left, so we'll stay off man flu if that's okay. But that's a separate panel discussion, I think, for another day. Yeah. So moving swiftly on, staying on the same subject. Anyone else got any more reflections upon those aspects, whether it be anxiety or just mental health in general?
Yeah, Adrian, I can jump in on that one. So as Midas, we do carry 12 mental health first aiders and 11 champions. Of which I'm one. What we have noticed is more and more people are coming to talk to us, which is encouraging. And as Jason quite rightly said, trying to get men to talk about their issues and anxieties is quite difficult. But we're finding the barriers are being broken down.
Yeah, and we saw a similar thing actually. Whilst we saw a drop in the use of our employee assistance program and other external systems that we have access to support, we did see an increase in the amount of internal discussions, whether that be to, we've recently done a survey with our mental health champions about the number of people that, have come and spoken to them, not just within the pandemic period, but just in general. But we've also seen, through management discussions, a lot more people coming forward in that respect. So actually, culturally, it's reassuring in some respect that people can come forward and have those conversations, whilst at the same time being conscious of the fact that people need to, there are a number of people that obviously need to have those conversations. I'm going to move on to a couple of slightly different questions. Something different, but this has also been picked up on some of the research around learning from the pandemic. And I'm keeping an eye out for any questions that pop up. So we haven't had any yet. So if some do pop up, then I will interject with those from our audience. But one thing that came up in some studies is actually about the speed of decision making, and some evidence that actually decisions were getting made quicker as a result of different ways of working. So there's a thought, in one hand, that some discussions are being siloed and they're not having the open collaborative discussion that would be available in the workplace, but actually some of the reports have suggested that decisions were getting made quicker and things were happening quicker. Would the panel generally agree with that? Alex looking pensive there about that one. You have to take yourself off mute though.
Yeah. Just to go back to the previous one, as everyone said, face-to-face, talking to people, I think the whole thing about we're all in the same boat, we all had to go to work, or a lot of us did. So, just sharing the experiences. as I said earlier, innovative ways of working, putting a sheet of glass or a door between two people so they can hang it and sort of maintain distances. There was an awful lot of very quick off the mark innovative thoughts, how you can put an air conditioning unit up with one person at the bottom of a tower and the other at the top, all sorts of innovative things that were quick. I'm not sure about the general management process, whether that was speedier or not. But I suppose we were all living. It was difficult times last year in particular.
Can I add a comment?
Sure.
I think that we are still in the bottleneck that is causing a backlog. And it's going to be years until we truly know the sort of the full impact on it. I mean, there's some immediate anecdotal stuff around, innovation is down and collaboration is down, but productivity is up. And I think those are fine as anecdotes and sort of opinion. But I think when you look in the healthcare system and you can parallel it with supply chain in construction, there are 6 million fewer referrals, or there were 6 million fewer referrals into healthcare in 2020 than there were in 2019. Those are not people that don't need referring and don't need help. They're people that just aren't presenting. And so where are they? And what risk is that carrying? And how is that sort of backlog going to play itself out with things like an aging population and, the issues that are now enhancing? So it's an interesting thing to sort of combine what we're seeing in the healthcare system and what we're seeing in construction related to productivity increases. But the mental well-being aspect of the impact of the last 18 months, we're not going to truly know the impact on the economy and on individuals for years to come. And yeah, that's. I'm actually an optimist. I am an optimist, but I think we just don't know. And I think anyone that says that I think anecdotes exist, but the reality is not going to play itself out for some time.
This is where you need to come in with some charts and some statistics, I think, in true Boris presentation style. One thing we've actually also experienced, and I'm interested in the general opinion around this, is actually I've seen evidence within my own teams and also and I've heard this within our general business, and we have about 3,000 employees at present, that actually people know each other better. Because of what we've been going through over the past year to 18 months and this kind of shared experience and shared challenge, I think we have generally been looking out for each other a little bit more. And actually, we've been spending more time to know a little bit more about each other. There's been some wild and some wacky things that I won't share on a public forum. But I think people have taken a little bit more time. I think when you go on to things like this, when you're all using technology online, the technology works really well. When you get mixed meetings where you've got people in the room and some, using Zoom or Teams, it becomes a challenge. But I think the immediacy of going online, people are actually talking a little bit more. The intro discussion is a bit more about what they're doing. So would the panel agree that we might know each other a little bit better?
Yeah, I would say that it's the old adage, absence makes the heart grow fonder. I think definitely people realise they're missing out that social interaction in the office or in the workspace. And when they were desperate to get back for it, they realised that it is a good place to be. Well, our company is, but hopefully everybody else is.
And we're all learning that we do actually still like people.
I think when you're dialing in from your bedroom, it's sort of inevitable that people get to know you a little bit better. So I think people are bringing their full selves because they haven't had a choice. Bringing their full selves, their full character to work when they've been working from home in particular. And I think that is a positive thing. I think understanding everyone has their stresses and strains, whether it is picking up the kids or the dog in the background, or, all the stuff that we've seen over the last 18 months. And it's leveled things, I think, significantly. There's no longer that mysteriousness of, a person's home life. It's all being brought into the workplace. So I think there is definitely positivity around understanding each other and having greater degrees of empathy. I think that is no bad thing.
Yeah, it's brought teams together, definitely.
I mean, put your hand up if you had to move something from the background of a camera, because it might be slightly embarrassing that you actually didn't want the other people on the call to actually see it. We have got a question on the Q&A, and I'll do that now, because I've got one short question I'm going to ask everyone just at the end before we close. We have about 10 minutes. So we have a question here from Cheryl, and it says, the lines of communication for mental health are growing now, but it would be great if all levels of staffing were involved, men or women on site, may not want to speak with their managers about how they are feeling. How are you dealing with this? So it comes back to that point about how are we ensuring that people are coming forward and really sharing, their concerns, their anxiety. What are you doing as organisations?
Can I jump in there? Again, this is what SWAG is all about. We've pooled mental health first aiders within the local industry with other contractors. So if I'm working on a site, I'm struggling, I don't want to speak to my line manager because I think there may be some detrimental effect because I am suffering mental ill health, I can phone or contact a mental health first aider from another company in strictest confidence, so I can then seek the help I might need from that individual. So it eliminates that false pretense that I might be judged poorly because I'm suffering mental ill health. So if we can remove that barrier by doing that, then I think it's a good way forward.
Yeah.
Ben?
Within Midas, what we have is we've got mental health first aiders at different levels as well, so right up to board. I mean, Brian Smith, our health and safety director, is a mental health champion. So everybody's numbers there, and what we have agreed that all of the health and safety first aiders and champions, our phones remain on till 9 p.m.
And that's a really interesting point, because we had that same discussion, Ian, and it was, again, there's an interesting consideration around mental health champions, and we have a large number of champions in the business from a wide range of backgrounds and ages, and one of the considerations with them is actually their age in comparison to the person that needs to approach a champion. So in simple terms, would a managing director who's in their 50s approach a mental health champion who's in their 20s? There are two reasons there. There's difference in age and life experience, but also that element of in terms of who does an MD turn to, and that's something that we've certainly picked up on recently in terms of making sure that that network of champions is balanced. Although we do assess them before we appoint them, we look at volunteers. But it's a really interesting area around mental health support. For those people that are signposting as champions, that we've got the right balance in that kind of cohort of people.
Ben, if I could just add, sorry to interrupt, beg your pardon, but what Jason and yourself have said, Adrian, as well, and Ian, we've got a good spread of mental health first aiders, but so what we've added into our business as well, slightly different approach, is that as part of a sort of staff initiative, staff benefit, we've actually sort of subscribed to almost like a private health insurance where you can basically provide a service to your staff that it's almost like phoning up your doctor. They can phone in mental health, and it's part of it's a sort of an add-on to our staff benefits package. That that includes sort of the physical side as well, but it's almost like a remote doctor service that we've added to sort of staff benefits. But again, if they don't want to talk to the mental first aiders within our business or sort of the popular sort of designated poster campaigns that you see, we've actually got that as an added benefit that's available to all staff as well. So I have to be honest, I've used it for my doctor's appointment in terms of, you say the referrals aren't happening, going back to your point, David, insofar as your issues don't go away because of COVID. So I'm someone that suffers a bit of a bad back, and I've still managed to sort of maintain and have the sort of physiotherapy and things, which is a huge result of our staff benefit. But again, just thinking about it differently, so we've all got the people in business, but there are these sort of specialist services that you can go out to and offer that to your staff. And yeah, I hope it's not being used, but I know sort of talking to people, it's sort of been greatly received as an add-on that we're thinking of them in a slightly different way as well.
Great, thank you, Ben. That's really interesting. I'm conscious of time, so I'm going to draw the general discussions to a close. I've got one question more so for everyone before I close, and it's a short one, so I'll go around in the panel. So on a personal basis, what's been your most positive experience? So I'll start with Alex.
For me, it's been being able to continue working throughout the pandemic, really. I would not have wanted to be struggling at home. I've worked throughout, I've been to the sites, and I don't know how other people would have coped, if I had been at home. So no, I've been pleased. I know it. As we said earlier, you get tarnished with a sort of, why are you going to work? But for me, it's been brilliant.
Good. Thank you, Alex. Ian?
I think for me, it's, the whole pandemic's been a bit of a roller coaster ride. So it's the way Midas has dealt with it. It's, we've gone from Midas to very much Team Midas. It's, it's the positivity and the barriers there were no barriers, but the barriers are just non-existent, and we can talk directly to everybody.
Excellent. Thank you, Ian. Jason, next, please.
Yeah, the biggest positive for me is seeing everybody supporting each other, similar to what Ian said, the whole team coming together and being there for each other. That's brought the family ethos of Cheesemere and swag to the forefront.
Thank you, Jason. Ben?
Echoes the comments from everybody else, really. I mean, from us as a business, people were furloughed, but we're pleased to say we haven't lost anybody. Everyone's still got a job that was here when COVID started. I think sort of keeping your staff, keeping the people together. There's a lot of people, unfortunately, have lost jobs, but we're very proud to sort of say that, we've kept everybody on board and, we're growing from strength to strength, really. So that's nice to see.
Excellent. That's reassuring. And David, please.
Thanks, Adrian. I would say that it's linked to the mission that we set out with at Eave to eliminate the isolation and loneliness caused by hearing loss. And actually, during the last year, we were able to work, and as part of the application we made here with Galliford Try Highways, where they rewrote their policy for noise management on site to mandate level-dependent hearing protection with integrated monitoring. And I think to be able to change that sort of local policy during this time, given that it is core to what we're trying to achieve at Eave, I'm still sort of on a high from that. So
decisions were being made quicker then, David. There you go.
Indeed.
Good. Right. It's coming up to time. So I'd just like to say thank you to all of our panellists for their candour and their feedback and participation. Good to see that technology has been kind to us as well. And I'd just like to remind everyone that you should see in the chat the details for the award ceremony, which starts at 5:30 this evening. And I wish all of those that are in the health, safety and wellbeing category the very best of luck in the award ceremony this evening. So thank you very much once again, and have a good evening.